And back now to Sunday House Call. You know, it promises to boost your energy and give you a new lease on life, they say, and that's testosterone replacement therapy. It's getting pretty popular among a lot of men, but how do you know if it's right for you and if you should do it? Dr. Samadi, tell us about this. You hear about a lot of men now saying, I'm doing it, but does it work?
Eric, the ads are working. Almost every other ad is about testosterone. There's a deodorant. There's all these injections that you should be getting testosterone. And unfortunately, men are falling into this. Is it really the fountain of youth? Or is it really the fountain of dollar for a lot of people out there that are opening up these low T centers and really without the appropriate tests, without having a doctor on board, are giving big doses of testosterone to men out there? Now, they basically say that low testosterone symptoms are if you're tired, you're fatigued, low sex drive, you may be gaining some fat around the belly, etc., lower muscle mass, then you may have low T. But a lot of other things can cause this. For example, one of the major reasons why we have low T is because of obesity. If you have belly fat, the question is it the egg or the chicken? So if you're obese, you're going to have lower testosterone. The treatment is not to give you testosterone, but to lose the weight and go get exercise. If you drink a lot of alcohol, if you have low thyroid, if you're diabetic, lack of sleep, stress, all of those are the reasons why your testosterone can come down. My big problem is that people are over-treating this, they're overdoing it. A lot of men out there are getting testosterone for no good reason. FDA is now adding a label to these. It causes blood clots. It can cause cardiovascular, heart attack, and stroke. And I want a lot of people to be aware of this. Once you go on testosterone, you shut down your natural testosterone, and your testicles can shrink. And if you get off them, you may not be able to produce that testosterone. Well, so that's very important.
Mark, it doesn't sound like it really is the end-all and be-all.
Well, you know, let's look at it this way. We're disease detectives. I love that term that the CDC is throwing around. We're disease detectives. Somebody comes to the office, an older male over the age of 50. He's gaining weight, especially around his belly. He's fatigued. He has a low sex drive. He's depressed. And I start to go, or David starts to go to see what the reason is. And as David just mentioned, it could be a thyroid, could be diabetes. It could be that you have a low testosterone, but make sure before you even address the low testosterone to correct the other issues. Is the person depressed? I like to try lifestyle alteration, Eric, before I would even consider anything else. Because did you know that if you sleep more, your testosterone can go up? Was the testosterone level checked in the morning? It's got to be checked in the morning to be accurate. You know, and what else? Are you depressed for another reason? Do you have a thyroid condition? So then, once the question comes whether to treat this, I think one of the reasons there's overtreatment is that too many internists are knee-jerking and putting people on testosterone gels, patches, injections, without really thinking about it. And the biggest problem, in my opinion, is that testosterone causes you to make a lot of blood cells. And you know what those blood cells do? David just told you, it causes blood clots. So the FDA has a warning now. It can cause blood clots. Guess what else the blood cells can do? They can go into your arteries lining your heart. That's why there was a 30% increase in a big study in circulation just last year on people that had testosterone replacement. And the study that I like the most is in something called PLOS1, name of the journal, doesn't matter. Men under 65 that had pre-existing heart disease had 2 times the amount of heart attacks in 3 months after starting this therapy, and old men over the age of 65, older men over the age of 65, 2 to 3 times greater risk of heart attack and stroke.
So is it possible to misuse the testosterone? And why is it important, the timing of the testing of the levels of the testosterone?
Well, because the peak of testosterone is around 5 a.m. No medical office is open at 5 a.m. You should be checking your testosterone between 7 to 10 a.m. because in the afternoon it comes down. As a urologist, I will tell you also check your PSA and know what the PSA is. One of the complications or side effects of testosterone is that if you have an enlarged prostate, it can make your symptoms much worse. And there's also a lot of debate about whether too much testosterone can cause prostate cancer. The debate is still out there. The jury is out on this. But you can't just have a knee-jerk reaction. If you're obese and you're tired, take these testosterone. The side effects outweigh the benefit.
Bottom line, exercise, eating, and those type of actions before
Absolutely.
Okay.
Get on that elliptical. Get in the gym.
Well, the number of these prescriptions have tripled. I mean, we've gone from like 18 million to now 2 billion this year, and in 2015 we're going to be about $5 billion on testosterone. Don't tell me so many men out there are walking around with low testosterone.
Plus,
It doesn't
what-
make sense.
What a great point that the doctor's office is closed when your testosterone levels are highest. So then when you show up to your office at 3 p.m., it's low. And it's like, hey, doc, I got
I'll
low.
open the office for Eric to come in at 5:30 a.m. How about that?
This is why people like Sunday house call, Ortho. We're not
personalized
pushing products. We're not
Yes.
pushing these quick fixes. We're about medicine here.
That's true.
All right.
See you
Well,
at 5:30, Eric.
Yeah, I'll call it in.